Hello, welcome to the Marshmallow Clinic. Are you here for your cranial nerve exam? Okay, perfect. Just make sure I have your folder here. And let me see if I have any questions for you. Mr. Smith, right? Okay. Okay, and have you ever had a cranial nerve exam before? Okay. And who were you referred here by? Your general doctor, okay. Okay, and can you tell me the reason you were referred here? Okay. So smells were becoming overpowering to you. Did that turn into any sort of headache? Yes, okay. Okay, let's see. And are you having any problems with your vision? Anything blurry? Any pain? Do your eyes get extra tired at night? Anything like that? No? Okay. And when is the last time you had an eye exam? Okay, 4 months ago. So you should be pretty caught up on that. Do you wear contacts or glasses? Contacts, okay. And how long do you wear your contacts for a day? Okay. That's perfect. Yeah, those 24-hour ones are great. So you do change them every day, correct? Okay, perfect. Okay, have you ever had any issues with your eyes before, other than just the vision? No? Okay. Okay, I think that is all the questions I have for you. So today, basically, what we're going to do is, we're just going to go through and do some sensory tests. And basically, we're going to be testing everything from your nose to your hearing to your eyes. I'm going to do some facial muscle tests, just to make sure that everything is working properly, that your cranial nerves are all sending the correct messages to your brain, okay? Are you ready to get started? Okay. It's nothing that's too difficult. First thing we're going to do is test your sense of smell. Since you are having problems with that, we'll go ahead and get that one out of the way. So what we're going to do is basically I have these little vials here, and all I'm going to ask you is to close one of your nostrils. You're going to smell this and just tell me what it is, okay? So go ahead and close your first one. And what smell is that? Okay. It's cinnamon. And go ahead and close your other nostril for me, please. And what is that? Mint. Okay, very good. Now, did those two scents cause you any discomfort? Okay. The cinnamon one does. Okay. Let me just write that one down. It's just a burning sensation. Okay. So, let's see. Okay. Does that give you a headache so far? Okay, good. Okay, so it's more when you're in the room with an overpowering scent. Okay. Okay, the next test we're going to do is just a basic eye test, which you've just had done, so it should be fairly easy for you. Where I'm just going to hold up this chart here, point to some numbers some letters, and ask you to tell me what they are. Okay, let's go ahead and start with some of the easy ones at the top. Okay. Yes. Mm-hmm. Mm-hmm. Right. Mm-hmm. Okay, let's jump down here. Right. Mm-hmm. 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 Okay. Mm-hmm. Mm-hmm. Yeah. Okay. Alright. Can you see this one down here? Okay. Alright. Okay. What about this one? That one's too small. Okay. did very well. Looks like they have you in the perfect prescription for your glasses. Go ahead and record that. Okay, the next thing we're going to do is continue with your eye test. And basically what I'm going to do is check your eyes to make sure that they move very smoothly, okay? So the first thing I'm going to test for is to make sure that there's no lagging in your eyes and your peripheral vision, okay? So what we're going to do, we're going to start with both of your eyes. So just look straight at my face here. And I'm going to take my finger and I'm going to wiggle it in each corner. And you just tell me as soon as you see my finger wiggling, okay? Okay, so go ahead and stare straight ahead. And just tell me when you see my finger. Good. Good. Perfect. Okay, great. So now we're going to do the same thing, but with one eye. So go ahead and cover one of your eyes. Okay, and just tell me the same thing when you see it. Great. Perfect. Okay. Same thing, other eye. Okay. Okay. Perfect. Okay. So that was easy enough, right? Okay. Next thing we're going to test is to make sure that your eyes are moving smoothly. So I'm going to take this little pointer here. And basically what you're going to do is keep your head still one more time, stare straight at my face, and I'm going to move this pointer, and I want you to follow it with your eyes, okay? We're going to do the same thing, start with both eyes open, okay? Okay, so easy enough. We're going to do the same thing again with each eye, so go ahead and close your first eye for me, and we'll start again. Ready? Just follow that star. Okay, great. Same thing. Other eye. Ready? I'm just going to look at your eyes and make sure I don't see any jagged movements, that they're all just smooth. Everything looks great. Okay. And the next thing I'm going to do is just measure your eye. And all I'm going to do is just look very closely at it and just measure the size and shape and make sure that everything looks normal, okay? So I'm just going to open your eye here. Okay. Okay, that one looks good. And your other one. Okay. Okay. I think everything looks great. If there were any problems, I'm sure that your eye doctor would have noticed that, okay? So we're going to move on from there. And the next thing we're going to do is test your touch receptors. So what I'm going to do is I'm going to take this little Q-tip right here, and all I'm going to do is touch your face very lightly with it. And you just tell me if you feel that, okay? Ready? Okay. 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 Perfect. Okay. Okay, very good. Now I'm going to do the same thing again. This time I'm going to use a cotton swab. Do this one twice because this has a different feel to it, and you might not be as sensitive to this one, okay? so the next test we're going to do is I'm going to test your ears. So what we're going to do is I'll ask you to cover one of your ears, and I'm going to whisper a number into the opposite ear. And you just tell me what number I said, okay? So let's go ahead and we're going to start with your right ear. So just go ahead and close up your right ear. Okay? 5. Mm-hmm. 8. Mm-hmm. 13. Mm-hmm. 20. Okay, perfect. Now we're going to do the same thing. Just go ahead and close your left ear. 4. Mm-hmm. 17. Mm-hmm. 2. Mm-hmm. 80. Very good. Okay, so that was it for your ear test. So the next test we're going to do is we're going to test your motor neurons in your face to make sure that your facial muscles are sending the correct messages to your brain, okay? So what I'm going to ask you to do is to clench your jaws up and make that really tight for me, and I'm just going to touch some places again with my Q-tip and just make sure that they're clenched properly, okay? Okay, so go ahead, clench that up for me. Okay. Mm-hmm. Okay. Mm-hmm. Okay. There seems to be a little bit of a sensitivity on this side, is that right? Okay. Write that down. Can you tell me what happened there? Okay. So they had your jaw wired shut because of that accident? Okay. Let's see. And how long ago did that happen? 2 years, okay. Now, did you notice that your hearing issues and the smell issues started around the same time as that? Okay, so that's only been within the last year. Okay. Now, does that cause any problems for you with your eating or anything like that? Your jaw tightness there? No? Okay, good. Okay, let's see. So now what we're going to do, we're just going to go ahead and do the same thing on the other side. Get my Q-tip here. And go ahead and clench for me. Okay. Yeah, you can definitely see a difference there. Let me just kind of grab those. I'm just going to feel that with my hands because I do see a difference on this side. You can definitely tell it's tighter on your side right there. Okay. Okay. So your right side is fine. Your right side is the tight one. Yeah, I'm sorry. You have me all confused. Okay, and the left side is the normal one. Okay. Now, when you were in that accident, did anything damage anything on this side of your face, your left side? No? Okay. Oh, so you fell on, okay. Okay. How long did you have it wired shut for? 6 months. Oh my gosh. Okay. Okay. So the next couple of tests we're going to do are going to be the same thing. We're just going to be testing your facial muscles again. So I'm just going to need you to do a few simple things for me, okay? The first thing I need you to do is raise your eyebrows, just like that. Okay. Check that off. Eyebrows. Check, okay. I need you to go ahead and frown for me. Okay. Now, I'm going to ask you to do something a little different since you did have an issue with your jaw on this side. Can you take your mouth and push it to one side like this? Okay. So you can do it to the left. Can you do it to the right? Okay. So let's tighten on that side. Okay. I struggle with that also. I can't do it to that side either. So don't worry about that. We just want to make sure that when they had your jaw wired shut that they didn't do anything to damage the neuron pathways, okay? So basically, so I just wanted to check that for you. Okay. Now what I'm going to ask you to do is close both of your eyes as tightly as you can. Okay? And I'm going to try and open them up for you. Just keep them closed. Okay. Very good. It seems that your eyes are really strong. Okay. Next thing I'm going to do is ask you to show me your upper teeth. Okay. Perfect. And your lower teeth. Like that. Okay. So it's painful when you have to do that. Okay. And again, I'm sure it's just residual healing, you know, and it could be something that's not permanent. It might just be the tissue that's healing in your jaw there that's causing you pain with that lower teeth, okay? So I don't want you to worry about it, that they did something wrong or anything. It could just be the healing scar tissue. So what I'm going to do at the end of the appointment is I'm going to give you a recommendation, and I want to see you back in another year, okay? Just to make sure that that's healing properly. Okay. Now the next thing I want you to do is just smile for me. Okay. Now, has your smile always been crooked? Okay. See, again, I think it's just a healing thing. That's why we want you to come back, just to double check and make sure that everything is fine, okay? Okay, so it's tight on the right side. And a lot of times, you know, all of these things are connected, all of our senses. So it could be that that jaw is tightening and it's causing something in your brain to stress, which can be causing the issues with your sense of smell and the headaches. So it's all connected. Everything in our facial region is, because all of those nerves run to the same spots. They give our brains, you know, the like to keep the synapses firing. I don't know how to say it any other way, but it's all in that same area. So I don't want you to stress about it, you know, but we'll just finish this up and then we'll talk about it, okay? Okay. Now I need you to puff out both of your cheeks for me. Okay. See, you can puff out both, that's fine. Does it cause any discomfort right there? No? Okay, see, that's good. Okay. Okay, so the next thing we're going to test is, I'm going to go ahead and do a taste test with you. This is always the fun part. And basically what I'm going to do, I'm going to get one of these little swabs here, and this is going to have, I'm going to dip it in something that tastes, and I'm going to just drop it on your tongue for you, and you just tell me what the taste is, okay? Very easy. Ready? Okay, stick out your tongue for me. And what is that? Spearmint. Very good. See, most people just say mint, so you knew it was spearmint. You're doing awesome. Next one. Ready? Coffee. Very good. Okay, we have two more for you. Do you need a sip of water or anything? Okay, good. Next one. Strawberry. Okay. And the last one. Banana. Very good. Okay. You don't have to seem to have any problems with your taste test. Everything seems to be normal. Okay. Now, the next thing we're going to do is just a few more motions, facial things. I am gonna look at your tongue first, so let me go ahead and do that for you right now. Okay, just go ahead and poke your tongue out. Okay, and I'm just looking to make sure that there's not any visual bumps or any irregularities with it, so just poke out. Okay, yeah. Okay, everything seems to look good with that. Now we're gonna go ahead and do the worst part of the whole test. Basically, what I want you to do is poke your tongue out again. I'm gonna hold it down with this little star, and I'm gonna activate your gag reflex, okay? It's the worst part of the test, but it tells us, it just makes sure that everything is functioning properly, okay? So it'll just take a second. Okay, it's no worse than having a flu swab. It's actually even quicker. So just go ahead and poke your tongue out for me. Okay, perfect. No problem. You feel okay? Okay, good. Okay, the next things are going to be easy, and all I'm going to do is basically just ask you to shrug your shoulders up and down for me, like this. Okay, looks like your right one again is a little... Did you have surgery on your shoulder as well? Okay, so... Okay, it's dislocated, and then they did a surgery to relocate it for you because you have issues with it. Okay, great. So yeah, you can see that one kind of like this a little bit. But that's fine as long as you're still healing from that. It's okay. And the next thing I want you to do is turn your head from side to side like this for me. Okay, perfect. Now the last thing I'm going to ask you to do, just going to examine your face and make sure that everything looks okay, that it has the appropriate measurements, and that everything is symmetrical. Okay, so I want you to just look straight at me. Okay. Okay. Now, did you have any issues with your nose in the accident? Okay, it's always been like that. Okay. Let's see. Okay, everything looks great. Now, if you would, go ahead, please turn your face to the side. And I'm just going to check over here. Look at your ears. Okay. Side of your face. Okay, perfect. And now the other side. Okay. Okay, everything looks great to me. Right, do you have any questions for me? Okay. So, just look at your results here, your chart. Basically, the only issues that I see are all the issues that have to deal with that jaw there. So I think I want to see you in 6 months. I know I said here, but I just feel like that's something I want to keep my eye on for you, okay? So let's see. So 6 months from today, I want you to come back. We're going to retest everything. I am going to give you a prescription for a medicine for your nose. And what that's basically going to do is going to work in your brain, and it's going to stop the neurons from firing those senses, so it won't be overwhelming to you, and you probably will notice a decrease in the headaches, okay? In the meantime, if you do have the headaches still, you can take any over-the-counter thing like an Advil or anything like that. So feel free to do that. You may notice that your sense of smell is a little bit dulled for a while. That's not a problem. I mean, I would prefer if it were me to have a dulled sense of smell rather than something that was hurting me. So, okay. So you're just going to take those 1 time a day. And then in 6 months, I want to see you back and make sure everything's okay. Are you doing any kind of physical therapy with your shoulder or your jaw? Okay, good. So just tell me what your physical therapist doctor's name is. Dr. Jones. Okay. So what I'll do is I'll just fax these results over to them so they'll know to keep an eye on that for me. And if you don't have a problem with it, they'll just update me on your progress with that. Is that okay with you? Okay. So we'll just fax them and keep in touch with them to make sure that everything is okay on their side. So I do want you to come back and see me in 6 months, okay? And we're going to keep an eye on everything for you and just make sure that everything is healing well with this. Once you come back and your jaw is healed, we're going to stop you on the nose medicine. And if that improves, if your nose symptoms improve and your headache symptoms improve, then we'll know that's what it was, okay? So, and then if that's not it, we're going to have to look a little bit deeper, maybe do like a CAT scan or an MRI to kind of get in your brain and your body and make sure that there's nothing else working against you, okay? Do you have any questions for me? Okay, well, I will see you in 6 months, and it was great to meet you.